B12 is known to enhance alertness, cognition, energy, vision, to elevate mood, lower anxiety and pain, and to relieve insomnia. It's one of 8 B vitamins, it's water-soluble, and it's found in every single cell in the body. B12 is essential for the synthesis of DNA, RNA, and neurotransmitters, the maintenance of myelin sheets protecting the neurons, and red blood cell formation. A deficiency in B12 results in myelinopathy, or spinal cord disease, neuropathy, or nerve disease, sensory disturbances, imbalances when walking, weakness, and psychiatric problems ranging from cognitive to behavior problems to dementia. B12 is needed to regulate homocysteine. High homocysteine levels are linked to inflammation, and this can lead to blood vessel damage and possible plaque buildup leading to heart attack and stroke. B12 is a cofactor in the synthesis of the neurotransmitter dopamine, GABA, norepinephrine, and serotonin. It affects alertness, cognition, memory, and mood. B12 helps to increase brain serotonin and dopamine levels. This can decrease anxiety, depression, fatigue, and pain. B12 is called cobalamin because it contains a rare element, cobalt. B12 is absorbed in the intestines from food or from a supplement using a process called intrinsic factor. The vitamin is then transferred to trans-cobalamin 2, and this acts as a transporter. Through a very complex process, the B12 is converted into the active form coenzyme 5-deoxyadenylyl and methylcobalamin. Foods rich in B12 include fish, shellfish, meat, especially liver, poultry, eggs, milk, and milk products. The best sources by far of B12 are clams and liver. You can't get adequate amounts of B12 from plants. Vegetarians and vegans are especially in danger of a B12 deficiency, regardless of what food and the supplement manufacturers say. Plant foods contain analogues of B12, and these are similar to, but not the same as B12. They bind to the B12 receptors and they block your intake of the true B12. Trying to get your B12 from yeast products is also problematic, as these products don't contain B12, but they're fortified with it. B12 is also light sensitive. If it's stored in open bins or clear plastic jars, the B12 vaporizes and disappears. Meat and animal products are the best source of B12, but once again, relying solely on food for adequate B12 is difficult because it's destroyed during cooking. B12 is a precursor in the biosynthesis of all major neurotransmitters in the brain, including acetylcholine, dopamine, GABA, norepinephrine, and serotonin. B12 is an integral part of a 1-carbon cycle involved in the synthesis of methionine. This amino acid, methionine, donates the metal groups required for methylation to occur. This biochemical process helps to synthesize neurotransmitters, myelin, the sheet that protects the neurons, and it keeps homocysteine levels in check. Elevated levels of homocysteine has been associated with several neurodegenerative diseases like Alzheimer's and Parkinson's. Even a mild B12 deficiency has been associated with accelerated cognitive decline. Researchers at Tufts University examined data from 549 men and women enrolled in the Farringham Heart Study. They focused on scores in the mini mental state exam, which is a short list of questions and tasks used to screen for dementia. The subjects were divided into 5 groups based on their B12 blood levels. The scores declined by 0.24 points per year over an 8-year follow-up period. Cognitive decline was faster in the bottom 2 groups that had the lowest levels of B12. The researchers concluded having plasma blood levels of B12 from 187 to 256 picomoles per litre predicts especially rapid cognitive decline. B12 is a precursor in the biosynthesis of GABA and serotonin. GABA is an amino acid and a neurotransmitter produced by glutamate in the brain. This inhibitory neurotransmitter prevents other excitatory neurotransmitters from being released, resulting in an anti-anxiety and a calming effect. Serotonin is a neurotransmitter made from the amino acid tryptophan. This inhibitory neurotransmitter governs the stimulatory neurotransmitter dopamine from overwhelming your brain. Adequate serotonin levels make you feel confident, easygoing, flexible, happy, and positive. One case study out of India reviewed the case of a 57-year-old woman who was given months of antipsychotic and antidepressant medication, including 2 rounds of electroshock therapy, before anyone thought to check her B12 level. The woman's symptoms included anxiety, constipation, movement abnormalities, perceptual disturbances, hearing her name called, lethargy, tearfulness, and finally catatonia. She remained depressed, suicidal, and lethargic despite her treatment. Within 2 months of identifying her B12 deficiency and subsequent treatment, this woman reverted to her baseline, and she remained stable with no additional treatment. A B12 deficiency is usually caused by neurological and psychiatric issues in adults aged 40 to 90. A B12 deficiency rarely affects younger people, but it can be a problem if a mother is deficient during pregnancy. A B12 deficiency can manifest as disease of the spinal cord, disease of the nerves, sensory disturbances, gait abnormalities, weakness, cognitive and behavioral disturbances, and dementia. When there's not enough B12, the neuron myelin sheath is damaged. Neurons degenerate. Weakness, vision problems, cognition issues, and abnormal reflexes can occur. Bladder and erectile dysfunction can happen. Tingling sensation, pain, and numbness can also occur. There can be delusions, hallucinations, memory decline, depression, and dementia, brain shrinkage, and impaired DNA synthesis and replication. A B12 deficiency can often be caused by pernicious anemia, which is an autoimmune disease, and it affects the mucous membrane layer of the stomach. This can be the result of destruction of parietal cells, lack of hydrochloric acid, or failure to produce intrinsic factor. Parietal cells are required to create the intrinsic factor to supply your body with the adequate B12. When these cells are damaged, the intrinsic factor is not produced, and B12 cannot be absorbed for use in the body. Parietal cell death can be caused by excess alcohol consumption, ulcerative gastritis, Helicobacter pylori infection, gastric bypass surgery, and even age. Intrinsic factor is required for B12 absorption from the food and supplements. If it's left untreated, you'll experience a B12 deficiency, even if you're getting the B12 from food and supplements. If you or your doctor suspect a B12 deficiency, and you do a blood test, and the labs can show the B12 levels within the curve, it still doesn't reflect how much B12 is actually in your cells. Pernicious anemia is sometimes passed down through families. This is most common in those of Scandinavian or North European descent. Graves' disease, Addison's disease, type 1 diabetes can all also cause pernicious anemia. When you take B12 cobalamin as a nootropic supplement, it's transported across the intestinal wall by the carrier protein intrinsic factor. It's then degraded, freeing the cobalamin to be attached to trans-cobalamin 2 for transport to the cells in your body. B12 is a cofactor in the 1-carbon cycle that's required for the synthesis of DNA, RNA, and neurotransmitters, and for the myelin sheath that protects each of the neurons in the brain. This 1-carbon pathway is involved in the synthesis of the amino acid methionine. This amino acid donates methyl groups for the methylation of DNA, RNA, neurotransmitters, and myelin. Methionine is synthesized from the amino acid homocysteine. Preventing high levels of this amino acid to accumulate can prevent problems throughout the body, including neurodegenerative diseases. Cobalamin is also required for the conversion of methylmelanyl-CoA into succinyl-CoA, for the myelin sheet that protects the neurons. Problems with this conversion degrades the myelin. This causes problems with your central nervous system, and it damages the axons on the neurons in your brain. B12 can reduce the severity and the frequency of asthma attacks and allergies. It can reverse early signs of Alzheimer's disease. It can lift your mood by boosting the happy molecule serotonin. It can reduce the side effects of metformin, the diabetic drug. It can provide optimal concentration, focus and memory, reduce the risk of macular degeneration and prevent blindness, maintain healthy hair, skin and nails, remove homocysteine and protect your heart. It can raise sperm count and improve sperm mobility. It can prevent neuron damage if you lack intrinsic factor. It can reduce some of the symptoms of schizophrenia, and it can help to prevent osteoporosis and build strong bones. The key message here is to maintain the optimal B12 levels in your body and your brain. If you've got a specific health problem like pernicious anemia, or you're deficient in the B12, supplementation can definitely make a difference. Users who supplement with B12 report a reduction in brain fog and better sleep. People on statins for cholesterol and metformin for diabetes report a dramatic decrease in pain. Users report better focus and mood. Colours can seem brighter and more intense. Energy levels can improve, and an overall improved sense of well-being can occur. If you're B12 deficient, you may feel a big boost in energy, and feelings of deep exhaustion can disappear within a few days. Much of the research on B12 and B12 deficiency is presented as individual case reports. One report in French about a woman with no history of psychiatric problems, but upon admission was uncooperative, disoriented, had memory problems and attention problems, a sleep disorder, and she looked older than her real age. The woman was depressed, had a guilt complex, devalued herself, and her movements and her speech were very slow. A lab test revealed she had a problem with intrinsic factor. Her therapy was B12 replacement, using hydroxycobalamin 1,000 milligrams per day for 10 days. Her mental state improved dramatically within a few days. Another case report of a middle-aged man with obsessive-compulsive disorder. When he was given methylcobalamin therapy, the symptoms of the OCD dramatically improved. A study in Stockholm explored the association of low B12 and folate levels with the occurrence of Alzheimer's disease. A population-based study sampled 370 non-demented people aged 75 years and older who had not been treated with B12 or folate. This group was followed for 3 years to detect the incidence of Alzheimer's. The researchers compared low levels of B12 and folate with people who had normal levels of the two vitamins. Subjects who had low levels of the B12 or the folate had twice the risk of developing Alzheimer's, and the association was even stronger in subjects with good baseline cognition. The study concluded B12 and folate may be involved in the development of Alzheimer's disease, and that monitoring the blood B12 and folate concentration in the elderly may be relevant for the prevention of Alzheimer's disease. Research shows people with major depression often have low blood levels of folate and B12. Low folate levels are also linked to poor response to antidepressants, and treatment with folic acid and B12 has been shown to improve the response to antidepressants. Folate and B12 are involved in one-carbon metabolism, in which SAMe is formed. The SAMe donates methyl groups that are crucial for neurological function. Increased homocysteine is a functional marker of both folate and B12 deficiency. Increased homocysteine levels are found in depressed patients. One study out of Norway showed increased blood levels of homocysteine was associated with increased risk of depression, but not anxiety. The researchers concluded doses of both folic acid 800 micrograms per day and B12 1 milligram per day should be tried to improve treatment outcomes for depression. B12 is water-soluble and is considered non-toxic in recommended doses. A varied diet, including meat, seafood and milk products, can provide enough B12 to prevent a deficiency, but vegetarians and vegans can't get enough B12 from the food and they should supplement. Typical recommended doses for nootropic benefit and optimal brain health is 100 micrograms or 0.1 milligram of B12 per day. Users older than 40 or those who have a problem with B12 absorption should use 100 to 400 micrograms per day. If you test B12 deficient, you could be recommended to take 5,000 micrograms per day for a week, followed by 1,000 micrograms per day afterwards. B12 is non-toxic, so it's considered well tolerated and safe. Doses as high as 2 milligrams of B12 daily by mouth or 1 milligram monthly by injection have been shown to produce no significant side effects. When high doses of B12 are given orally, only a small percentage can be absorbed, and this likely explains the low toxicity level. Proton pump inhibitors and other drugs used to treat acid reflux are known to prevent the absorption of B12, so you might need to take the B12 sublingually. Antibiotics, drugs to treat gout, and metformin to treat diabetes all decrease the B12 levels or the B12 absorption. If you use any of these drugs, you should have your levels checked and possibly supplement with B12. Nitrous oxide, used as anesthetic or as a recreational drug, oxidizes and inactivates B12. It's recommended to stay away from cheap cyanocobalamin supplements. Go with methylcobalamin or adenosine-cobalamin or hydroxycobalamin. B12 is especially helpful for people dealing with brain fog, fatigue, nerve pain, sleep and memory problems. B12 supplementation is critical for anyone over 40 years of age because of absorption issues with B12 from food. B12 is also particularly helpful if you're using proton pump inhibitors for acid reflux, if you have type 1 diabetes, or you show positive for dementia or Alzheimer's. The recommended dose of B12 for deficiency is from 2,000 to 5,000 micrograms per day. Remember, B12 needs to be balanced with B6 and folate for best results. Also, if you have an MTHFR polymorphism, you may need higher doses of B vitamins. You can check out my video on the MTHFR polymorphism. And if you're eating a lot of food that's been fortified with folate, it can throw off the readings of a B12 blood test, hiding a deficiency. For more information about vitamins, minerals, herbs, and natural treatment plans, check out my website.